Honourable Speaker, sir, today I rise before the House to provide an update on the global COVID-19 pandemic. Honourable Speaker, in the February sitting of Parliament this year, I informed the House about the novel COVID-19 disease and the threat it posed to the world and to Fiji. Honourable Speaker, within 3 months, there has been more than 5.4 million confirmed cases and more than 346,000 deaths from COVID-19 global pandemic in 216 countries and territories of the world. And it's still rising, Honourable Speaker. At times it seemed to have waved and waned, but it continues to rise. 6 months ago, Honourable Speaker, we did not know about COVID-19. Now this new disease is driving the new normal way of living, working and relating to each other. We recorded our first case of COVID-19 on the 19th of March 2020, and our last confirmed case of COVID-19 in Fiji was diagnosed on April 20th, 2020. Fiji has now recorded 18 confirmed cases and no deaths from the 6 local individuals who imported the disease from abroad. I am pleased to report that it is now 36 days since our last case of COVID-19 was reported. More than 2 incubation periods for the disease, and 15 of the 18 confirmed cases of COVID-19 have fully recovered and have returned to their homes. This, Honourable Speaker, means that the recovery rate for COVID-19 in Fiji now stands at 83%. The 3 active patients that remain in isolation in Nago Hospital are all stable and well, but they remain because there are still active cases on the tests that are done to them routinely. None of Fiji's cases have had severe illness, and none have required intensive care unit level care. And it wasn't by fluke. It was by a dedicated group of personnel and also the resources that were given to them by government to do the work that needs to be done. This highly infectious disease requires stringent, non-medical interventions to stop its spread. Although it's a new disease to the world, knowing how the disease spreads and how we can prevent transmission from the sick to the healthy is critical to ensuring that our families are protected against COVID-19. Honourable Speaker, I would like to highlight our response to this global pandemic and elaborate on 6 key areas which we have been asked to share with many countries around the world on our success. Firstly, its leadership. Our Prime Minister, the Honourable Josiah Warange Bainimarama, has been at the forefront of our fight against COVID-19. His firm and decisive leadership and the support of my senior colleagues in Cabinet and the critical government agencies and statutory bodies ensured an efficient decision-making process and the timely implementation of containment strategies that reduce the risk of spread of the disease in the community. I acknowledge the strategic thinking and leadership shown by the Minister for Economy, the Honourable Mr. Ayaz Said Qayyum, in devising a timely and comprehensive budget through the Supplementary COVID-19 budget that has facilitated the whole of government and the whole of society response towards the COVID-19 outbreak in Fiji. Honourable Speaker said, COVID-19 was included through gazetted regulations as a notifiable disease. This paved the way for health officials to be able to quarantine suspected cases of the disease under relevant sections of the Public Health Act. Further regulations were gazetted through the powers given to the Minister and the Permanent Secretary for Health and Medical Services to allow for the control of public movement and to enforce social or physical distancing. Our main objectives were to protect the population against further spread of the disease, while we enhanced our health surveillance system and strengthened our health response program in the community. Sir, a multi-agency steering committee chaired by the Permanent Secretary of Health and Medical Services was formed in January 2020 as the forum that informed and coordinated the response across government towards the disease outbreak. This forum was later converted into a Permanent Secretary's Forum, which played an important role facilitating the whole of government response to COVID-19. The National Health COVID-19 Task Force that comprised senior health managers within the Ministry of Health, health partners, local and international health experts, specialists from WHO, the Secretariat of the Pacific Community, Fiji National University, the private sector monitored the global and local outbreak situation and provided policy advice to the Minister and Permanent Secretary for Health and Medical Services, as well as to Cabinet on the global pandemic. The incident management team for COVID-19 was established on 2nd of March 2020 to plan, coordinate and facilitate the integrated national multi-agency public health response. And this was ably led by Dr. James Wong and Mr. Vimal Dao, our Chief Health Inspector, as being the Chief Operating Officer. The Ministry adopted this WHO model and implemented it for the first time, a full large-scale incident management team. The IMT, which has representation from most government ministries and the discipline forces, operates 24 hours a day and provides daily briefs to the Minister and ministries through daily face-to-face briefings, situation reports, and the updates when required. And the $40 million that was set aside for COVID-19 was run basically out of this incident management team, separately from the Ministry of Health's normative functions of the $340 million budgeted to it in the in this current financial year. Honourable Speaker, on 27th March 2020, Parliament approved an additional supplementary COVID-19 budget of $40 million for the Ministry of Health and Medical Services. A series of critical regulatory changes were also approved, which have facilitated the control measures required to quickly and effectively stop the disease outbreak. Secondly, on border control, Honourable Speaker, Fiji began the screening of passengers for symptoms of COVID-19 from January 28 at the Nadi International Airport. Fiji had been preparing well before the disease reached our shores, and one of the first nations in the world to introduce the supplementary health arrivals card specifically for COVID-19. Since 2nd February 2020, all incoming passengers have been required to complete this card before disembarking at any of our international ports of entry. We have found this intervention to be extremely valuable in our ability to quickly identify and track down all contacts of suspected cases. And we have heard reports of nations where, when they later had community transmission, they then implemented the arrivals card. And in retrospect, they said maybe they could have done it earlier. In a sequential manner and guided by the expert health advice on the global pandemic, the Department of Immigration placed border restrictions that banned the entry of non-citizens into the country. Initially from China, then eventually from all parts of the world. Fijians were exempted. Those returning from these countries were required to home quarantine initially for 14 days after arrival. Then later, on the 28th of March 2020, they were compelled to undergo quarantine at the government-designated quarantine facilities for a prescribed period of time. We left our border open to our own citizens. The Department of Immigration had also issued travel advisories against Fijians against overseas travel. On 16th of March 2020, all cruise liners were banned from entering Fiji waters and docking at any port in Fiji. The international airports and seaports were shut down on the 26th of March 2020, and only Fijian citizens and international trade remain open. And on the 30th of March 2020, all yachts were banned from docking at any port in Fiji. And if we look right around the world, Honourable Speaker, we will see that there have been countries that had significant spread or super spreading of the disease within the cruise liners docked within their waters. To date, we have monitored over 5,840 individuals in various forms of quarantine and isolation, and achieved 92% surveillance compliance from all our quarantine individuals as reported by our health teams and through our own Ministry of Health software for contact tracing. Thirdly, Mr. Speaker, disease surveillance and response. Honourable Speaker, members of the discipline forces and other civil servants joined the Ministry of Health and Medical Services to assist with carrying out community surveillance through fixed and mobile fever clinics, quarantine enforcement, and contact tracing teams operating in each of the divisions. 40 fixed fever clinics were set up around the country in strategic locations, 11 in the Central Division, 15 in the Western Division, 8 in the Northern Division, and 6 in the Eastern Division. To date, these fever clinics remain functional and have seen 16,757 people as of yesterday, while 142 people that had been seen in these fixed fever clinics were then required to have testing, and all of them have been negative. The mobile fever clinics conducted house-to-house visits and reached 809,704 people by the 26th of May. This is more than 92% of our population. And when we include the 16,000 from the fixed fever clinics and the 810,000 from the mobile fever clinics, you can see that more than 830,000 of our people have been screened. This massive undertaking has become a feature of the whole of government COVID-19 surveillance response, and it is a testament to the truly national coordinated response to the pandemic. Apart from these active screening activities, the Ministry of Health and Medical Services used the pre-existing early warning surveillance system for influenza-like illness. Influenza-like illness is used as a proxy for COVID-19 surveillance, as symptoms are similar for both diseases, and we are in the flu season, so as to speak, in our part of the world, Honourable Speaker. Any unusual increases or spikes were investigated immediately by the Fiji Center for Disease Control or Fiji CDC as potential COVID-19 clusters, even though we know at this moment that predominantly if there were spikes, they were likely to be just the normal flu that we have in our flu season. This system has been recording an average of 95% reporting compliance rate from the 69 surveillance sites throughout Fiji. The EWAS, or the early warning system, recorded the onset of the flu season in Fiji in February 2020 and reported the declining number of influenza-like illness by May 2020. Honourable Speaker, this brings me to the laboratory testing capability for COVID-19. Fiji started laboratory testing of COVID-19 on January 28th, with samples shifted to the WHO Collaborating Centre Reference Lab in Melbourne, Australia. A total of 19 samples was tested at this lab for Fiji from the 28th of January to 12th March this year. I wish to acknowledge the support of the Australian government, and in particular the reference laboratory in Melbourne, for their support, guidance and technical advice to our local experts at the Fiji Centre for Disease Control. Fiji commenced testing for COVID-19 at the Fiji Centre for Disease Control from the 11th of March 2020 using molecular-based real-time quantitative reverse transcription PCR testing, or RT-PCR for short. This is a globally recognized and approved standard of testing for this virus. The testing capacity has recently been further enhanced with the introduction of gene expert testing capability, also a molecular-based test, but with a shorter turnaround time of less than 1 hour for results. Since January this year, patients have been tested for COVID-19. If they have acute respiratory symptoms and a history of international travel or contact with a case of COVID-19, or have been admitted to ICU with severe respiratory illness. By 19th of March 2020, we amended our testing criteria to include all the close contacts of cases if they were symptomatic, or at the completion of 14 days of quarantine if symptomatic. To date, all individuals under quarantine have compulsory laboratory testing for COVID-19 after 14 days of quarantine. And this includes close contacts, returned international travelers, and healthcare workers involved in the direct care of confirmed COVID-19 patients. We are testing outside, in and outside the WHO criteria, beyond the WHO criteria. So we are testing aggressively and widely, Honourable Speaker. All patients admitted to ICU with symptoms of severe acute respiratory illness have also been tested for COVID-19. In addition, Honourable Speaker, we have also identified 10 health facilities in the public and private sector in all health divisions in the country to be sentinel testing sites. And they are now testing patients with respiratory symptoms for COVID-19, adding further surveillance capability. As of 26th of May 2020, we had conducted a total of 2,431 tests, which averages 33 tests per day. This equates to 2.47 tests per 1,000 population. Furthermore, we are doing 121.5 tests per confirmed case. So that means, Honourable Speaker, we generate 123 tests to have one case positive. And by this measure, we compare favorably with the rest of the world, in that Australia does 153 tests per confirmed case, and South Korea does 69.1 tests per confirmed case. We are testing more widely standardized for population than South Korea. Honorable Speaker, sir, let me now talk about the isolation facilities. From the onset of this global pandemic, the Health Ministry had initially identified key hospitals as isolation facilities. These included Naboo Hospital, CWM Hospital, Lotok Hospital, Nandi Hospital, and Lambasa Hospital. We also identified 17 health facilities to provide surge support for COVID-19 if required. In total, we have identified and created a combined isolation facility bed space for 128 patients. Honorable Speaker, there was much hue and cry when we announced that Naboo Hospital was being used as an isolation facility. However, to date, this facility has and is being used successfully as the COVID-19 isolation facility for the Central Division. While other health services continue to be offered from this facility, I pay special tribute to the people of Seru and Lamosi and Health Team Ninavuo for their understanding, dedication, and support to make this work effective. Apart from the health facilities, the Ministry and other government agencies, with the leadership of the Divisional Commissioners, work together to identify and commission community-based isolation facilities to facilitate the outbreak response activity. Those facilities are located in strategic areas and provide a total of 390 beds ready for any surge in cases. The government has also invested in intensive care unit equipment, consumables, and medical supplies, which has been ordered to boost the inpatient care capacity in all the major hospitals and isolation facilities in Fiji. We have doubled our ICU capacity and continue to look at avenues to ensure that our patients are treated early and adequately to limit ICU need. And I thank Fiji Airways for providing freight flights and bringing back this much needed equipment and consumables. Honorable Speaker, sir, another area that was addressed was communication and information. The government has been forthright and transparent with information on COVID-19, with regular press conferences to update the public on the progress of the disease in Fiji and the response measures implemented. We developed a comprehensive communication plan, which included a community awareness package on COVID-19 that was delivered to all villages and settlements in Fiji. All media outlets were engaged through media releases, press statements, press conferences, social media posts, frequently asked questions, posters, and videos that included one by the Fijian men's sevens team that became viral, amassing more than 3.5 million views globally. Through the Ministry of Communications, we also put in place a toll-free number 158, which has received more than 9,000 calls, averaging about 150 to 200 calls per day. Honorable Speaker, apart from our contact tracing mechanisms, the Honorable Prime Minister and Honorable AG Mr. Syed Kamyum have recently announced the introduction of a Care Fiji app. This application uses Bluetooth technology and will significantly enhance Fiji's COVID-19 countermeasures. This phone application is intended to enable a community-driven contact tracing. The app is based on the Singapore model using Trace Together, which uses the Bluetooth Relative Signal Strength Indicator RSSI readings between devices across time to approximate the proximity and duration of an encounter between two users. This proximity and duration information is stored on one's phone for 28 days on a rolling basis. Anything beyond that would be deleted. It is currently going through a verification process before it will be trialed and tested and made available for the Fijian public as early as next month. Honorable Speaker, in understanding how this disease is spread, we introduced measures to enforce social or physical distancing early February and further gazetted them as public notices under the Public Health Act of 1935 on the 4th of April 2020. These measures were relating to limitation of the people gathering, inter-island travel restrictions, persons in queues, and distance that they had to adhere to. They have been done to prevent the further spread of COVID-19 once the disease was diagnosed in Fiji. Prior to the diagnosis of Fiji's first case of COVID-19, overseas travel for government ministers, permanent secretaries, civil servants, and staff of statutory bodies was stopped, while international events and participation of overseas guests at local events was not permitted from the 18th of March. Honourable Speaker, government introduced a selective lockdown of areas based on risks at various times since 19th of March. And these were implemented from 14 to 28 days in the Greater Lotoka area, the Suba area, the Nambo settlement in Suba, the Soso settlement in Labasa, and the Vunidangi settlement in Riketi in Maduata. Non-essential services and business were also stopped and banned in lockdown areas. We've been successful in ensuring that no transmission of COVID-19 occurred in these lockdown areas. All nightclubs, bars, gyms, cinemas, swimming pools, and fitness centers were closed from the 20th of March 2020, while restaurants were required to limit their seating to less than 20 persons from the 23rd of March 2020. Honourable Speaker, we are at a unique and enviable position in the world. We have stopped the disease in its tracks, and our comprehensive surveillance and testing are telling us we have no more presence of the disease in the community. We have learned from that, and we cannot afford a second or third wave of the disease. In closing, I make a special mention and acknowledge the leadership of the Prime Minister and all Cabinet Ministers, the Permanent Secretaries, the heads of the disciplined forces in the military, police and correctional services, divisional commissioners and their leadership teams, and all government agencies and all civil servants and government workers. I thank the leaders of the community, religious leaders of all faiths and denominations, civil service organizations, Turani Koros, Advisory Council leaders, traditional leaders for leading and supporting our response. I thank all the fathers and mothers for showing the example and leading the way. My special thanks to all the frontline health workers, disciplined forces, border control officers, social workers, civil servants and support staff for your commitment, courage and dedication to be on the front line of this pandemic. I reiterate the call of the Honourable Prime Minister that you are the new heroes of our time. In closing, Honourable Speaker, in the measles epidemic of 1875, where more than 40,000 Fijians died, estimated about 40% of our population, our people were helpless. They did not understand the science behind the measles. They lacked decisive and compassionate leadership, and no one walked the streets to tell them to social distance or take their temperature. This time around, we did not allow that to happen. I thank you, Honourable Speaker.